Welcome back to Module 4. We will be talking from Chapter 45 in the Med-Surg book, author's Iggy. And let's start talking about some risk factors. In your outline, one of the objectives was to describe the risk factors. Let's talk about some risk factors, and those are things that can be modifiable and non-modifiable. We talked about modifiable and non-modifiable for other things, for our cardiac, so let's continue with that. Here are some things that are risk factors for us. Cigarette smoking, hypertension, drug use. All of these things are modifiable. Okay, but the things that are non-modifiable, trauma, sickle cell anemia, African American, Hispanic, and Indian, our background, our heredity, our genes, males, unfortunately, older age, genetic tendencies, all of these things, atrial fibrillation, all of these things are non-modifiable. So let's talk about stroke. Let's talk about a little bit of the pathophysiology. This is directly from the American Stroke Association. As of 2019 this year, a stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by clot or burst or ruptures. When this happens, part of the brain cannot get the blood flow or oxygen it needs. So it and brain cells die. I want this class to be aware that stroke is the #1 cause of death and leading cause of disabilities in the United States, as well as 80% of strokes are preventable. They are preventable. So these are our signs and symptoms of stroke. Let me just make this a little bit more clear for you. As healthcare providers, we should educate our patients and the community on what we should do if we notify a patient, if we see or observe a patient that's having signs and symptoms of a stroke and how they need to get to the medical center as soon as possible. So I won't read these off to you, but it is called FAST, F-A-S-T. And you can look at each one to see what each letter stands for and how important it is to get that individual to the emergency room as soon as possible. For the general public, they are aware of FAST, FAST. You are a healthcare provider and you should know other symptoms that could signify that the patient is having a stroke. So please don't forget these. Sudden numbness or weakness to the face or arms, sudden confusion, sudden trouble seeing, sudden trouble walking, dizziness. This happened to a friend of mine. She just was in her heels walking and she noticed, she was losing her balance and she was leaning towards one side. And when she went to the emergency room, they just kind of rubbed it off like maybe she had an inner ear problem. But it was much more than that. She actually was experiencing signs and symptoms of a stroke. Even that severe headache. If someone comes in and tell you, this is the worst headache of my life, we need to treat that as an emergency. Okay, if someone shows any of these symptoms, we need to call 911, or in the hospital, we need to call the rapid response team immediately. I apologize, but I was trying to get as much information as I could on here. I know that this slide is very busy. Please pause it and read it. It is speaking of some things outside of our scope of practice at this moment in beginning med-surg. But when you become a registered nurse, you will need to know this. And I'm sure they're going to reinforce it in med-surg 2 and 3. But I wanted to have it here so at least you heard of it before. Ischemic stroke. Now, an acute ischemic stroke is caused by the occlusion, or you want to say blockage, of a cerebral or carotid artery. Remember I was mentioning those arteries earlier about MCA? It's blocked by artery by either a thrombus or an embolus. Now, I'm sure that we understand what a thrombus or embolus is, but I will go over that just in case. Now, know that a stroke that is caused by a thrombus, which is a clot, a thrombus is a clot, is referred to a thrombotic stroke, So when you hear that, it was a clot that caused that stroke. Whereas a stroke that's caused by embolic That means a dislodged clot is referred to as an embolic stroke. The clot dislodged and it traveled through, causing a embolic stroke. Please read this slide as it is in detail as per the book, and so you can have a clearer understanding. I did want to add that transient ischemic attacks, they are better known as TIAs. The symptoms resolve typically within 24 hours. That's very important to know that your TIAs resolve within 24 hours. Patients do have visual deficits, mobility deficits, sensory perception deficits, and speech deficits. But these deficits, they resolve typically over 24 hours, which means that whatever that was blocking, whether it was an emboli or a plaque that was blocking, it broke up and it moved, and therefore blood and oxygen got to that area of the brain, and the patient was able to have that function, whatever the deficit was, have that function return back to its normal function. You can also see trans-ischemic attack on page 928 in your chapter 45 in box 45-1. Here's a video to help explain ischemic stroke and embolic stroke. It's going to start quickly. So this is silent, and here we go.
A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via two major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. Similarly, the blockage may be due to an embolus, a blood clot that forms elsewhere in the body and travels to the brain. The embolus lodges in a narrowed artery and obstructs blood flow. Injury and death. If you have an ischemic stroke, you may be given medication to break up the clot causing your stroke. Later, your doctor may recommend surgery, such as carotid endarterectomy, to reduce your risk of having another ischemic stroke. During a hemorrhagic stroke, abnormal bleeding disrupts normal blood flow. For example, in an intracerebral hemorrhagic stroke, a blood vessel bursts, spilling blood directly onto your brain, while robbing the intended tissue of nourishment. Both the hemorrhage and lack of blood supply, called ischemia, destroy brain tissue. A subarachnoid hemorrhagic stroke occurs when a weak spot in a blood vessel wall, called an aneurysm, bursts and leaks blood into the tight space between your brain and your skull. The high-pressure bleeding results in serious damage to brain tissue. Immediate treatment for your stroke may help to minimize brain cell injury and death. In the case of hemorrhagic stroke, emergency surgery may be necessary to repair damaged arteries or reduce the pressure of the blood on your brain. You may be given medication to help the brain's blood flow return to normal.
Those were great videos. Now when we continue to do our assessment, as registered nurses, we're responsible for doing the NIH stroke scale. So we assess our patients and we give them a number according to their responses. I want you to know up here, nurses are also performing complete neurological assessment on arrival to the emergency department. The National Institute of Health Stroke Scale is a commonly valid and reliable assessment tool that nurses complete as soon as possible after the patient arrives in the emergency department, and is used as one assessment to determine eligibility for IV fibrinolytics. So I'm just going to scroll through this here. It is so you'll know what the nurses are doing if they call a cold stroke and why are they doing that type of an assessment. Okay. This is also found on page 931 in chapter 45 of your med-surg book. Also, I'd like for you to turn backwards just quickly to chapter 41 on page 847, and it's assessment of the mental status. So I want you to understand about the level of consciousness. Is the patient alert? Is the patient lethargic? Are they comatose? Are they stuporous? Now, to get those terms, it's on page 846, which will explain to you a little bit more in detail. But when you see LOC on a chart, this is what they're asking for, the level of consciousness. Understand this chart, and then you'll be able to understand your patient assessment when they had a right or left hemisphere stroke. You'll know what's happening on each side, so you'll know what the patients will be displaying in your assessment. Look at this paragraph up here. Right up here, it shows you about your right and left and what is more common on each side. Very helpful, along with these terms that was provided to you earlier, but I thought I'll point them out to you again as they are coming directly from your book. Okay. And while I continue on, I want you to take a brief look at the site of lesions causing visual loss. Let's talk about improving that cerebral perfusion. I don't want to get too deep into it, but know that there are some interventions. Hospitals have made themselves stroke centers now. Most hospitals in the United States are stroke centers, but a lot of times when they're out in the rural areas, they use something called teleneurology, where the neurologist speaks over the line and try to do an assessment with those facilities that are way out there. There's also non-surgical management. There's fibrinolytic therapy. Patients get something we call TPA, or sometimes you hear nurses say clot busters. And the most important thing, it needs to be within the 3-hour window. The 3-hour window. According to the American Stroke Association, they're pushing it out to 4.5 hours, but a lot of hospitals still stick to the 3-hour window. And when I say 3-hour window, I'm speaking of from the time that the patient start experiencing the symptoms to the time that they get the medication. So if they experienced it last night, went to sleep, they went to sleep and they come to the hospital, they're not really a candidate for the TPA. That's why it's very important to know the last well-known time. I want you to look at the highlighted areas. All of it's important for the Joint Commission core measures that I pointed out here, and I'll also point it out down here. Although you saw the videos, I wanted to point out this slide and also regarding your aneurysm and the other malformation.